United States has one of the highest teen pregnancy rates in the developed world. Nearly 750,000 teen pregnancies occur each year. 59% end in birth, and more than 1/4 end in abortion. 66% of all high school seniors in Tennessee have had sexual intercourse. 24% have had 4 partners or more. 1 in 4 teenage girls in the U.S. has had a sexually transmitted infection. How can we improve the odds for Tennessee teens?
Major funding for NPT reports Children's Health Crisis is provided by the Healthways Foundation, addressing the critical issues of children's health and public education. The Monroe Carroll Jr. Children's Hospital at Vanderbilt. The Nashville Healthcare Council. Baptist Healing Trust, fostering access to compassionate healthcare in Middle Tennessee. Additional support provided by the Orrin H. Ingram Fund and by members of NPT. Thank you.
As a parent, I want my children to become healthy, active, and responsible adults. This means they'll have to learn how personal behaviors impact their health. Hi, I'm Kimberly Williams Paisley. As children grow and develop, they will eventually face decisions about sexual activity. These decisions have consequences for the rest of their lives. But too often, children aren't prepared to make healthy choices. They don't know the risks of sexually transmitted disease or unplanned pregnancy. Many don't understand their own changing bodies. On this edition of NPT Reports Children's Health Crisis, we'll learn the roles sexuality and sexual responsibility play in the health of Tennessee's children. Stay tuned.
I didn't really know anything about sex. Sex is like a forbidden territory. With my mom, she was like, anything you can tell me, like me and her relationship is pretty open, but it's always the fact that you want to avoid talking about sex with your child. Like no one wants to do that. So it's kind of like a don't talk about it, maybe it'll go away type thing. So we really didn't talk about sex.
Even though sex wasn't talked about, it was all around Sherelle. At her middle school, many of her friends were already sexually active.
It was just, I guess, the happening thing. If you weren't doing it, then you were the outcast. I was not the average student. Like, I read a lot of books, I was in school a lot, so I wasn't the troubled teen. My parents had to look out for that type of stuff. I was 13 when I got pregnant. My parents didn't know I was having sex until I got pregnant, and by then it was too late.
I was 14 when I got pregnant. I thought because I lived in Brentwood, I could not get pregnant. I never considered getting on birth control at that point. I didn't feel like I had a way to get on birth control either. I mean, because it wasn't a conversation that I was having with my mother. It wasn't a conversation that I was having with any other adult around me. After I had my child, my doctor was the first person to bring up birth control with me.
In 2009, Tennessee had the 9th highest teen birth rate in the U.S. Though Tennessee's teen birth rate has declined in the last 20 years, more than 10,000 babies were born to teen mothers across the state in 2009.
Babies born to teenage women are more likely to be born prematurely, are more likely to be born at low birth weight, and in fact, those babies are more likely to die before they reach their first birthday than if a baby was born to a mother who was older. So there are certainly serious consequences for the baby. There are also serious consequences for this mother. This teenage mother now is much less likely to finish school, much more likely to have difficulty obtaining a job in the future, much more likely to live in poverty in the future.
I definitely feel like I was treated differently afterwards. Once you're pregnant, everybody knows. And I mean, it definitely goes to show, like, people can handle not talking about it and, like, silently, you know, just understanding that sex is happening and going on, but they don't like to look at it in the face.
The first time I think I got pregnant, it was like it just happened type thing. Like, I woke up and I was pregnant. But the second time really caught me. Maybe if I would have got a little information from school or from my parents the first time, maybe there wouldn't have been a second time.
When we think about young people growing up, there is a lot of times this sense of urgency right as they're entering puberty or kind of going into high school, that all of a sudden we need to have the talk about the birds and the bees. We need to understand that sexuality is much more than just the physical components of who we are. It's the emotional, it's the psychological, it's the social. It's how we identify ourselves as in terms of our gender roles, how we relate to one another in relationships and in friendships. The truth of the matter is that the discussion around healthy sexual development and sexual identity really is a lifelong, it's a life course conversation.
All right. The second one's named Lily. Who's the one that was born?
Here in Middle Tennessee, people are hesitant and a little fearful at best, and not sure where to start or what to say. Knowing that something needs to be said, but not sure what to say past don't have sex. And that's where oftentimes where the conversation stops.
My parents never talked to me about sex. It was really a thing that my school did.
A lot of it I had to figure out on my own, just from listening to conversations around school.
Even though my mom was really honest, I hit puberty a lot earlier than my classmates, and so boys took an interest in me way faster than I was ready.
My parents, they waited too late to give me information.
Show of hands, who had the talk? Traditionally in this country, when we talk about teen sexuality, our biggest concern is teen pregnancies. That's not the only consequence that can happen to them having unprotected sex. One of the things that they should really consider thinking about is the exposure to sexually transmitted infections. But we are beginning to see sexually transmitted infections increase. If a teen becomes pregnant, if they have a baby, the baby's gonna love them. Unfortunately, HIV, its only intention is to kill your child.
The adolescent population far and away has the highest risk of any age group for most of our sexually transmitted diseases.
Sexually transmitted diseases are the most common infections tracked by the Tennessee Department of Health. Roughly 300,000 samples a year are tested for STDs at the state laboratory alone.
We have a list of about 70 different infectious diseases that have to be reported to us, and far and away, the two most common are chlamydia and gonorrhea. For chlamydia alone, we have about 29,000 cases a year. 10,000 of those are in teenagers.
Chlamydia is on the rise in Tennessee, but it's not alone. HIV rates have nearly doubled in Davidson County for 15 to 24-year-olds.
We were showing these graphic pictures about of these very nasty pictures about what the STIs can do to your body.
I'll mention something about an STI, and they'll be like, what is that? I've never even heard of that.
Like 6th grade, I think, was my first relationship, and it was beyond awkward.
I remember in 8th grade when I was attracted to someone that I figured it out by learning what other people have done.
I did mainly what other people told me to do or what they expected, like, hey, go hold her hand, hey, you should touch her butt.
I realized I was gay when I was about 9 or 10 years old, but we didn't talk about it in health class, so I had absolutely no idea what to do, and I was just kind of ignored.
Even before the 7th grade, definitely remember having feelings that I was like, I don't know what I'm supposed to do with this. I feel like this is bad. Because nobody's spoken about it, I probably should not either. When I became sexually active, I didn't really know what was going to happen. I really did think that the only two outcomes of having sex was an STD or pregnancy. And if that didn't happen, like, you were good, you were out of the weeds. But there was so much else that went along with it. And I think that my misunderstanding of that, played out in a lot of other behaviors for me. And I just became, for a little while, not such a very healthy teenager.
Adolescence is an incredibly challenging time. If we just talk about sexual activity, then just think about pregnancy and sexually transmitted infections. We miss the boat on healthy relationships, on good decision making, and we end up with bad consequences.
Growing up in Nashville, the small town within the Bible Belt, and a preacher's kid, you learn so much about sexuality as a hush-hush situation and culture. Even though it's present everywhere, you don't talk about it.
For Chris, being gay complicated the issues.
It was kind of hard to find someone to talk to. It felt like I couldn't talk to my parents, I couldn't talk to my brothers, I couldn't talk to my friends at school. It just became this big issue of something that I had to deal with alone.
Isolation, silence, and stigma pushed Chris to look for an escape.
I've had suicidal thoughts. I couldn't deal with life because of who I am. Your parents say, I love you, but then you're thinking into yourself, well, you don't even know this part of who I truly am.
Gay, lesbian, bisexual, and transgender youth face higher instances of bullying, sexual abuse, and double the rate of suicide. They are also more likely to contract a sexually transmitted disease.
It has very negative consequences when you have to deal with not being true to who you are. The first person that comes to you and you have intimacy with, you think that's love. You don't care about asking them their HIV status or if they have any STI infection. Risky behavior becomes something that leads you and dominates you because you don't care.
Adolescence is really a time about carving out one's own identity and learning to make decisions independently. And a lot of that happens by trial and error. And so inevitably adolescents are going to make some bad decisions or engage in some risky behaviors. One of the unique things about this period of development is that adolescents have this sense of invincibility. It's not going to happen to me. I'm never going to be harmed by this behavior. And so it's hard to see beyond the moment and see those consequences.
In fact, young people may be at a disadvantage when it comes to making healthy choices. New research suggests an adolescent's ability to make healthy choices may be hindered by a brain that is not fully developed.
Specifically, what researchers are showing us are that the areas of the brain that are sort of latest to develop are the frontal lobes. The frontal lobes are important for sort of advanced thinking, sort of judgment and emotional regulation and impulse control. Oftentimes in their young teens, most adolescents are sexually mature. And yet we're recognizing that cognitive development occurs and continues well throughout the teens and perhaps into the early and mid-20s. So that sets young people up for sexually transmitted infections and for pregnancy and those sorts of consequences.
Biology may play a role in decision making, but culture and societal influence drive numbers too. Adolescents are constantly receiving messages about their sexuality, and not always from reliable sources.
My ultimate dream is to move to Jersey, find a nice, juiced, hot, tan guy.
I learned about sex from the videos and TV. From that, I learned that it's fun. Like, I learned that sex was something that everybody should join in. They don't show the STDs that you could get. They don't show the babies that you could have. They don't show the drama that you can have with your baby's father. They don't show that.
We know that adolescents spend on average about 7 hours a day using media, which is more time than they spend talking to parents or with their teachers or even with their friends. The really disturbing findings are that it seems that adolescents who are exposed to sexually explicit media are more likely than their peers to become sexually active at an earlier age.
If you look across the globe, most teens are going to be sexually active by 17, 18, or 19. What sets the United States apart is that we have one of the highest teen pregnancy rates in the industrialized world. Why is that? The simple answer is that contraceptive use is actually lower in the United States among teens than it is, say, in Western Europe or other industrialized countries.
Hey, what's up, Erin? How are you doing?
Good. How are you?
The more complex answer involves vastly different understandings of adolescent sexuality.
The Europeans accept that sometime during the teenage years, people will become sexually active. And so they really stress responsibility. And this is true in the home, but it's also true in schools. In the Netherlands, there was actually a study that looked at simply one question, which was, would you let your child have a romantic partner spend the night in your home? And overwhelmingly, Dutch parents said, yes, I would. Whereas American parents get sort of a visceral reaction and say, no way, not under my roof.
These cultural differences also affect the way teens in both countries view sexual responsibility.
Young people were asked in the Netherlands versus the United States whether or not they carried condoms. And in the United States, kids for the most part said, oh no, oh my gosh, my boyfriend would think I was a complete slut if he knew I was carrying this condom, or my friends would think that all I wanted was to have sex. Whereas in the Netherlands, kids routinely took out their condoms and said, yeah, look, I have it here. And that's because, it would be irresponsible of me, not to be prepared in that way.
The results for the Netherlands is a teen birth rate 8 times lower than in the U.S. Dutch teens also have fewer sexual partners, lower rates of sexually transmitted infection and abortion. Achieving those rates in the U.S. means something will have to change.
We've learned a lot of lessons over the last 2 decades about what we can do to help reduce our teen pregnancy rate, what we can do to help reduce our STI rate among young people. It's not a magic bullet. It's not a new kind of scientific innovation. We know that education works.
So yes, HIV and AIDS does not go anywhere.
Since 1996, all federal funding available for sexuality education was designated for abstinence-only programs. These programs teach abstinence until marriage is the only certain way to avoid the negative consequences associated with early sexual activity. Beginning in 2010, federal funding also became available for comprehensive sexuality education that includes information about effective use of contraceptives and condoms.
If you look across the globe at the studies of abstinence-only programs, overwhelmingly the evidence is that these programs do not work in any way to help teens delay or stop sex.
You call your ear a ear, right? You call your elbow an elbow. So why we can't call your penis or your vagina a penis or a vagina? Why do we have...
Now there has been a turn toward more comprehensive approaches and evidence-based approaches. And what you find is that when you combine messages around abstinence and birth control, relationships and negotiation, that you actually do help young people delay sexual intercourse, they have fewer sexual partners, and they're more likely to use contraceptives when they do become sexually active.
There's no evidence that giving young people information and giving them access to condoms and contraceptives increases the likelihood that they're going to be sexually active or become sexually active. The bigger question is, how do we ensure that young people adopt the consistent contraceptive and condom use when they do decide to become sexually active?
I've learned mostly about sex from the internet.
I actually had to go to 5 different people to get 5 different answers.
My generation has learned most things from the internet about sex, mainly from internet porn.
I got the logic part from books about sex, and then I got kind of the emotional aspect from porn.
It did kind of set me up for a failure in the sexual realm. Absolutely.
So in the bag you have a title that says Sexuality and Sexual Health.
One of the few opportunities available to all young people for sexuality education is in school. In Tennessee public schools, students get family life and sexuality education in grades 7 through 12.
Schools are a vital part of our health system and how young people receive information about sexuality. And in all honesty, without our school system, there are going to be some kids who are not going to get the information and not be prepared to make the best decisions that they can.
What risk does he open himself up to?
When you're dealing with adolescent teens, many, not all, but many are very, very interested in family life and sexuality education. They want to be educated about how to protect themselves, about what their choices are, about options. If they choose not to be sexually active, they want to know about those things. I have found in my years of teaching lifetime wellness, my students are more interested and more engaged in this material than any other material that I teach.
State law mandates all schools teach abstinence-based sexuality education. However, in counties with a teen birth rate above 19.5 per 1,000, sexuality education must include information about contraceptives and condoms. In 2011, 91 out of Tennessee's 95 counties were required to teach comprehensive sexuality education. In reality, what education looks like depends on the district, school, and even the classroom.
I have this wellness teacher. We were in class and it was one chapter about penis and vagina, and he was trying to beat around the bush. He was like the P word and the V word, and I was like, we're in high school, we're 16, 17-year-olds, we need for you to be comfortable to say penis and vagina. It made me think back to my youth pastors and my parents and how they expect us not to do certain things, but if you're not comfortable with talking about it and saying everything, then how do you expect us to come to you and ask you questions if you won't be comfortable with your own self?
What do you think about that comment?
When you're teaching very sensitive material such as family life and sexuality education, it's very important that teachers be given the resources that they need, the training that they need, the encouragement and support necessary to ensure they are delivering the very best information possible with this very sensitive material.
We need a more community-based approach that includes parents, guardians, other family members, community centers, faith communities. Anybody who is interacting with or cares about teens should in some way be talking about responsibility, decision-making, and sexual health. Because the schools can't do it all on their own, and they shouldn't have to.
I thought that you got HIV from having sex with a monkey.
I didn't think that, like, the pre-ejaculate, like, I didn't think that could get a girl pregnant.
I knew condoms existed, but I kind of thought you got carded when you bought them.
I didn't know exactly what was right, what was real, what was honest.
My son is 11 years old and a very bright boy, and but I have no idea what he knows about sex, intercourse, anatomy, and what he thinks about it.
Heather Harris wanted help educating her son about his sexuality. She found a program through her church that teaches 5th and 6th graders about anatomy, relationships, messages of abstinence, and discussions of media influence on sexuality.
A tough thing for us as parents to realize sometimes is that our children, they're not just those little babies we loved.
But it's also focused on parents.
Sexuality is one of those areas, I believe, where we can't be reactive as parents and wait till the child asks us a question. When they want to know, they'll ask me. Not always, if I have not shown openness to that kind of discussion.
Isn't easy, is it? No.
Parents are the #1 influence on a child's relationships and sexual activity, according to the National Campaign to Prevent Teen and Unplanned Pregnancy.
The goal is to help the children and their parents talk together.
How many times do you have to have sex to have a baby?
You hand it to somebody.
Okay, you get it.
It's not one conversation and we're done. Or I left the book on her table, that's all. If she has any questions, I told her to ask me. Parents need to be proactive about this.
I feel like the more information he has, the better choices he's going to make, the more supported and cared for he feels by his mom and his dad, other adults, the less likely he is to seek that sort of attention and validation in his peers or through inappropriate sexual activity. I mean, my hope is it will lead to good decisions.
Parents need to know that even as their adolescent is growing up and asserting their independence, that they're still reliant on their parents for information. Even if you start a conversation with an adolescent about sex, and he or she seems disinterested or gives you that, not now, Mom, you've still opened that door and you've conveyed to that adolescent that you're there, that you're listening, and that you care.
Right now, when you look at unintended pregnancy rates, those who are not doing well actually are young adults. We are not doing enough to prepare young people for when they are in their 20s, becoming more and more sexually active. That's when you really have high rates of unintended pregnancy. And we could be doing a lot more to prepare young people for that time in their lives.
I think it's real important to help the children understand that we all are sexual beings. In fact, help the parents understand that their children are sexual beings from birth. It's just that we're moving into a new stage of it with adolescence.
One of the key ingredients that we're missing to really address the issue is we have not included young people in the conversation.
We don't give teens enough credit in this world, period. When empowered and encouraged and supported, they are able to be thoughtful, provide important insights. We just don't always listen.
Young people will make the right decision with the proper support.
Having an open and honest channel of communication between parents and children takes time to develop, but it's important. Whether we are ready or not, our children will face decisions about sex now that will impact their health for the rest of their lives. It's up to us, the adults in their lives, to provide the guidance they need to make good choices. I hope you'll join me in learning more about the children's health crisis in Tennessee and what you can do about it by tuning into NPT's ongoing coverage and by going to wnpt.org/children's health. Thanks for joining us.
Major funding for NPT reports Children's Health Crisis is provided by the Healthways Foundation, addressing the critical issues of children's health and public education. The Monroe Carroll Jr. Children's Hospital at Vanderbilt. The Nashville Healthcare Council. Baptist Healing Trust, fostering access to compassionate healthcare in Middle Tennessee. Additional support provided by the Orrin H. Ingram Fund and by members of NPT. Thank you.